My presentation today will be on EEG technology, also known as electroencephalogram technology. First, to start off with our problem statement. Social media has become an integral part of our daily lives, but it is also linked to decreased attention spans and increased dissociation. This decrease in attention span and increase in dissociation can have serious consequences in academic settings and otherwise. Decreased attention span can lead to lower grades and reduced academic achievement. In the workplace, it can lead to decreased productivity and a lower quality of work. And in social settings, it can lead to reduced social skills and difficulty forming meaningful connections with others. Therefore, it's important to recognize the negative impacts of social media and take steps to mitigate its effects on our attention span and mental well-being. What's a possible solution? With our research, we've concluded that electroencephalogram technology, or EEG technology, is a game changer in how we understand attention and its impact on daily activities like social media use and academic performance. EEG technology measures the electric activity in the brain, providing valuable insights into cognitive function, including attention and focus. By developing a system that quantifies attention span, EEG technology can provide users with an objective measure of their attention and enable them to make informed decisions about how much time they spend on social media and how it may affect their academic performance. This system involves wearable EEG devices that measure brain activity while users engage in various activities like scrolling through social media feeds or studying for exams. The collected data is analyzed using machine learning algorithms to identify patterns and correlations between attention span, social media use, and academic performance. This technology can benefit educators and healthcare professionals who can identify students and patients who struggle with attention-related issues and provide targeted interventions to improve cognitive function. EEG technology has the potential to transform how we understand and manage attention-related issues. So what is EEG technology? EEG technology, or electroencephalogram technology, is a non-invasive and painless method used to measure the electric activity in the brain. This technology involves placing small sensors on the scalp, which detect and record the electrical signals produced by the brain. In our technology, we would have wearable EEG technology and devices. These signals are then analyzed to provide valuable insights into cognitive function, including attention, memory, and emotion. EEG technology has been used in a variety of fields, including neuroscience, psychology, and medicine, to study brain activity and diagnose disorders such as epilepsy, sleep disorders, and cognitive impairments. With recent advancements, EEG technology devices have become more affordable, portable, and accessible, making them a promising tool for studying the brain and improving cognitive function, therefore useful for our circumstance and problem. The research study that I want to focus on for this EEG technology problem statement and technology is addressing racial and phenotypic bias in human neuroscience methods by Webb, Etter, and Quazza. Just to give you a summary of the study, a research study by Webb, Etter, and Quazza published in Nature Neuroscience in 2022 addresses the issue of racial and phenotypic bias in human neuroscience methods. The authors argued that the lack of diversity in study participants and inadequate consideration of racial and phenotypic study participants and differences can lead to biased results and perpetuate inequalities in healthcare. The study proposes several solutions, including increasing diversity in study participants and developing new methods that account for individual differences in brain function. With a greater disparity in neurological technology development comes more of a bias against certain racial groups, something technology is becoming conditioned to do by ignoring situations such as this. The authors in the research study call for more attention to be paid to these issues to ensure that neuroscience research is more inclusive and equitable. To discuss the credibility of the study. The credibility of the article is noteworthy as it was published in a highly respected and peer-reviewed scientific journal, Nature Neuroscience, as well as the article is very recent, being published in 2022. Therefore, the information in the study is very recent and developed and is not outdated with its information. The authors are experts in the field of neuroscience and provide a thorough analysis of the issue, along with recommendations for how to address it. As discussed before, the authors called for more attention to be paid to these issues and for neuroscience research to be more inclusive and equitable. Overall, the article serves as a valuable resource for research and developers in the EEG technology field, as it emphasizes the importance of considering issues of bias and diversity in the design and implementation of these technologies. So what is the relevance of this research study to EEG technology? So we've seen that this research study discusses the issue of racial and phenotypic bias in human neuroscience methods. This is highly relevant to the development of EEG technology and other brain monitoring devices, because these tools are increasingly popular in both research and clinical studies to understand brain function and diagnose neurological disorders. If the study participants used are not diverse enough to accurately analyze brain function, then the tools may not lead to an accurate representation of the full range of brain activity in different populations, and this could lead to biased results and misdiagnosis, ultimately perpetuating healthcare disparities. Additionally, as mentioned before, the research study addresses the issue of racial bias, and the authors mentioned over and over again that the lack of diversity in study participants and inadequate consideration of racial bias can lead to biased results and perpetuate inequalities in healthcare. There are already a numerous amount of inequalities in healthcare, especially for people of color. Therefore, with the racial bias, phenotypic bias already present in neurological technology and development research, it will only become more of an increasing problem. So what is the overall relevance of this research study and this technology to social informatics? As we know, the field of social informatics is the cross-section and intersection between societal problems and technology, and how technology can help either harm or address societal problems. In the study, neurological technology examined creates racial bias in the technology being developed. Because the study participants are not diverse enough, there is a bias among the research. Because of this, it's apparent that it's necessary to eradicate the bias, as it ruins the efficacy of the product being developed. If this product is designed to cater to all needs in terms of social media and attention spans, it is necessary that all races and brain capacities are included. If this technology develops a bias against certain races, it's possible the scope of human thinking isn't covered. If researchers don't see the scope of brain activity occurring throughout individuals, especially test individuals, it's difficult to determine the true capacity of the technology being developed. The technology being developed may not reach every possible situation and scenario, especially in terms of EEG technology. By including various test subjects and various diverse groups of people, we can ensure that almost all brain activity is accounted for, and different ways of thinking and studying and analyzing brain activity is included. Thank you so much for listening to my presentation. My name is Rania Alvaconda, and this is my presentation on EEG technology.